Hey guys, let's get straight into it. All right, the question this week is, when should you see the dentist? So obviously we're relating it to kids, all right, and ideally we suggest that kids should come to the dentist when their first tooth starts to come out or within the first 12 months of their life. All right, now it does vary with kids at what age that tooth comes out. With my daughter's first tooth came around the 8 to 9 month mark, whereas Villas's.
So Alia had her first baby tooth when she was like 11 months. And so as a dentist and having baby teeth having to expected to come through at 6 to 10 months, we felt like terrible parents, even though it was a completely irrational response. So why are baby teeth so important? You're going to lose them, you're going to get some adult teeth, right? So why are baby teeth important? I guess we don't want to lose any of these baby teeth until they're meant to be lost. And the reason for that is because if you lose teeth, almost definitely, like too early, almost definitely you're going to be setting that kid up for braces, right? But also, like in the lead up to their adult teeth coming through, they could be walking around without their front teeth, until they're 6 or 7 years old. That can lead to, social issues. It can lead to difficulties talking, eating, all that kind of stuff. And remember, like painful teeth start with non-painful cavities. So this can lead to more cost. And I guess if that's the first time that you go to see the dentist, that can be a bit of a anxious experience, going in pain and going and seeing this dentist, especially if a stranger is like poking around and doing all this kind of stuff.
All right, so the last thing we want as dentists is to have a child that comes to the dentist for the first time in pain or with some trauma or something that's gonna not necessarily be the most positive experience at the dentist. Because often if they do, you might need the needle, you might need to use a drill, you might need to do something that isn't the norm that we want to create for these kids. And with that, if it is their first experience, it can often lead to more anxiety for them long term. And we want to avoid that as much as we can and keep it as a positive experience, even down the track, so that if there's anything that ever needs to be done, they already know that, look, it's a safe environment that they can trust the dentist. What we also look at when you guys come in, when the kids come in, is we'll look at the lips, we'll look at the cheeks, we'll look at the gums, we'll talk about oral hygiene, we'll talk about diet, we'll talk about all sorts of things to the mum, to the child, and the list goes on. But to really summarize, it's just what we want our patients to know is that keep the dentist as a trusted advisor to the family. And for that reason, the first time you come to see us at our clinic, when the kids come in, we just want to keep it simple and easy, and there's no out-of-pocket charge when you do come through to see us.
And we're not alone. There's a lot of dentists that we know who do the same thing. And the reason we do that is because as a community, as an industry, we really believe that if we start that child's dentistry journey and teeth journey the right way, life becomes better. Because we have so many adult patients who are scared of the dentist purely because they had a bad experience as a kid, And sometimes that first visit, it's like 10 minutes. It doesn't even lead to us looking in their mouths in any detail. Like, we'll check a couple of those things that we said to make sure, but it's really more about building trust and for that child to start seeing dentistry as an important part of their life. Okay, so 5 do's and don'ts of going to the dentist.
Going to the dentist for your kids. Yeah.
So number 1, don't tell your child to be brave. They already are, but also like telling your child not to be brave kind of puts the wrong thought in their head that there's something that they need to be scared of. So maybe don't do that.
Yep, don't bribe your child. All right, so don't. What you want is that you want the child to kind of view it as a positive experience. So you don't need to bribe your child that their birthday's coming up every year. And so really, you just want your child to come into the dentist, because what they might end up having is a balloon or a toothbrush or something at the end, which that gives them the positive experience that something's going to happen that's good for them.
Let us bribe them, basically.
Yeah, exactly. Yeah.
Don't tell your child it won't hurt or that it will. If they end up needing dentistry and they're going to need like needles or anything like that, just leave that to us. Part of our training is actually learning how to have these conversations with these little kids.
So that brings us to the next point, which is don't make the dentist a bad guy. All right, let us be our own bad guy if we need to be. We can tell the kid or mum or whoever in the chair that, look, there might be a little pinprick, or there might be a little mosquito bite or something like that, and we can do that, but you don't need to bring it up at home. Just leave it with us and we'll kind of get that bit sorted.
Yeah, we'll kind of calibrate it according to, like everyone's different, every child is different. We can calibrate it accordingly. And if you, the parent, are anxious about the dentist, it's a hard one, but try your best just not to show it if you can, because sometimes anxiety is contagious, right? So if you're really stressed and you think that you might have difficulty with that, two things. One, maybe get a trusted family member. So get grandma or someone to maybe bring them in just initially. And number two, come and see us or come and see your dentist, because dentistry's changed a lot, and we can definitely help you with that.
And if you can overcome your anxiety, then your child's going to see that
Absolutely.
and get the positive outcome from there as well.
Yeah, absolutely. Like as parents, we know ultimately our kids don't listen to anything we say, but they will model our behavior. And so if we can lead by example, everything gets better. And so the best thing I guess you guys can do is actually help yourselves. Put that oxygen mask in yourself first, and you'll be able to really look after those kids. Thanks for tuning in.
Yep, thank you to the ADA, thank you Nandika.
That's right, Dr. Nandika Manjanda, pediatric dentist, who helped us out with this, and the ADA gave us some really important information that we passed on to you guys as well.
See you guys next week.
Bye-bye.